enough space set up. Obviously we have our tray, which is just 2 trays, one's laparoscopic, so we're gonna have to make sure we have enough space on here. This is Samuel's setup, so I'm gonna go grab my gown for today, and obviously 7.5, right? So as soon as we're good to go, and if you were my partner, I would go over the actual preference card. I would say, hey, do you mind if you open this up for me? You go through it and verify what you want opened up. So the person that's with that person getting evaluated needs to communicate properly. Just don't start opening up until they're ready. That means having your field open, having a reinforced gown on there, and checking with you. Are you ready to open some stuff up? Now you can open up and they can just grab it. So it's probably better in your interest just to wait for they get in there, right? Obviously I have my glove, 7.5. We're making sure we have proper space. We're a little crowded here. If you want to move over, typically it's okay. So pretty much you guys know this already. Distance. Now this has a lot of memory. I've been telling a lot of people, I see people go like this and it just flips back. So in this case, let's just kind of sit here for a minute, make sure it's there. It's going to stay there, right? It's like wants to come back a little bit. Look, it's thinking about it. Right. Now I have a lot of people out in the field, and it's okay, because what is the parameter you can grab onto? Is it 1 or 2? It's 1 inch around, right? So I can't go like that, but I can grab around the edges. And a lot of people just go like this and then they stay. But out in the field, you're going to find that they go like this and just turn. I think either one's acceptable, for my personal opinion, out there. What that is doing, it's kind of giving you a barrier, so there's no metal showing, right? Here's where I'll probably screw up too, because these things stick a lot. But what you shouldn't be doing is this, right? It's just really just, you can get out of there, right? So you can go in there and pretend that you want to dry or get wet a little bit. You establish what needs to be opened. You got all the laparoscopic towers up. Patient's not in the room, technically. The only thing I didn't do is just open my field prior to doing the gown, right? Because I screwed up on that. So, Samuel, this is yours, right? Is everything in here? So scratch all that, make sure we open this up first before we do our gown. Now I see a lot of people going like this. And like they're bowing or something. So make sure you're not doing that. Obviously, that doesn't look good, right? I've seen it on videos. I don't know what it is, it's just I guess an instinct to come in like that. And I'm tall, right? So just be aware of that. So we established our field. I like to have a little space so I have my stuff open. Now you ask yourself, should I open this up? I see one of these fell. And you don't have a filter in here because evidently someone threw it out. So we're going to have to pretend a little bit. Chemical indicators in there, right? So you ask yourself, should I open this up before I scrub in? I would say, in this evaluation, wait until you get in there and your partner will open this stuff up for you. Because, I mean, either way is acceptable. But if you're working with me, Jordan, I'm going to set up. It could be a good 10 minutes. This is just sitting out here exposed. So if you're planning on leaving the room, and maybe you want to open it up. But in this case, for my evaluation, just let that person that's helping you open that up, right? So I got this in here. I pretend I scrubbed. Hopefully in the beginning you did your surgical scrub like you've done always. In this case, we're going to use a little alcohol rub. So have you been shown how to do this? All right, so it's typically the same way. Getting your fingers, obviously, all the way 2 inches, rubbing it in 2 inches above your elbow. Same thing with the other side, right? Getting pretty much in every little crevices, making your way down in the same kind of premise of the actual scrub itself. So this is here, right? I see a lot of people reaching in and they're really close to the gloves. In this case, since I have an alcohol rub, I don't really need to dry off. So in this case, I'm just going to grab that, kind of throw it off to the side. So the whole idea is just grab your gown as fast as you can and back out. Right? If someone want to tie me in, that's fine. been working out. Yeah, it's been a while. Got me? I'm trying to think about how to put the gloves on. So at this point, just get your gloves on like you normally do, making sure you don't rip. If you rip it, right, we're not going to stop. I'm not going to freak out. I'm not going to start all over. I'll get you a sleeve of shame to put over it, okay? We're going to keep moving. Obviously, I don't like the way that looks, but we got to keep going. The gentleman, obviously, will do this. Can't forget about that, right? Spin. But here, a lot of people do this. That's bad, right? So when you come to me, so I stay parallel to my chest, right? Not going back here. So at this point, what should I be doing? Looking at Sam's thing here. So I'm thinking about just, right, we need to reinforce this, mayo, ring stand, kind of simple, right? Do I have everything I need? Oh my God, I don't have any mayo stand cover. What do I do? Can I get a mayo stand cover, please and thank you? So if you don't have something, you don't freak out. But what I start doing is I start thinking to myself, what can I do while I wait? I can't get this on here because the tray's here. So I'm guessing I need a 3/4 drape. So what do I do? Right, so where's your 3/4? I don't know what Sam's is. Good Lord, Sam. So this is his 3/4, right? So I'll wait because this is a bad example of a wrapped one. So in this case, you can grab that and open it up like you normally do, right? Never turning your back to the field, right? Want to put your hand here. That's a good way of not turning. You can kind of go like this because a lot of people go like this, right? Got my hand stable. Now I can just grab that, right? Yep. I want to try to get as close. I see a lot of people like leaving this out here, setting up. You want to try to get as close as you can to kind of make sure no one can walk through your field, right? So you can probably open up that tray for me if you don't mind. As he's doing that, I'm going to keep on working. So I like people to try to get this nice and clean. And we're going to agree together as you do the filters. You lift them up, and what do you say? No strike through, no holes. I agree. But in theory, you can keep on working as you're looking, right? And eventually I'll get there to check an indicator. But what I'm trying to say is, you can multitask, right? You can still keep going. He's checked that filters. Now I can go over here and say, Chris, do you agree? A chemical indicator is good. You see that? Because it's just not me. It's about both of us, right?
Yes.
All right, so I agree. I'll grab that.
Chemical indicator is good.
And you're going to check the filters.
No moisture.
Okay, I agree. Okay. And so since I have my towels on, I'm just going to lay that right there temporarily so I can get that on. So I'm not sure which one is your 3/4 for this. I imagine this plane is. I don't know, it's just such a bad way to practice, but what I'm going to do is pretend it was like this. Oh my God. How did you wrap this, dude? So is this just your back table cover? Sam? You think so? So what I am going to do is, can you get me 2 3/4? And I'm not going to use these in practice on such bad things. And this was meant for your down sheet. It's for a back table one. So I'll wait. Let me get a 3/4 here. So we'll take this. Somebody in the actually had one more after that.
Need one more?
Yeah, please. Is this blinking? So when you look at it for this final evaluation, don't have anything that's wrapped crap. So we're going to use one for reinforce, one for your ring stand and one for the down sheet. Okay, and you can put that all into your packs. Okay, that's fine for me. Okay, so we got this open. We're good to go. We got our tray. We have a ring stand reinforced. Which one should I do first? Does it matter? Ring stand? Okay. Doesn't matter. I think either one's acceptable. In this case, what I like to do is just go out. So what would I do? Away or towards me first? Yeah, so just kind of go towards me, holding this. Okay. It's good to go, right? Pretty simple. And then someone that is maybe a circulator can come down below and wrap it around the legs, or when you break, you can go down there and wrap it around. Okay? Don't fall through. So on here, another 3/4. What do you do with these, right? So a good way to do is center it, because if it's over here, you open up, it's going to be too long on one side. Make sense? So just come to the edge, let it drop. Come to the edge, let it fall down. This needs to move out a little bit. You're fine. What you're not doing is you're not bringing this back up here, right? So where do I go? Away or towards me first? So, okay. Good. All right. You're good. You're not going below the field. You're not touching below here, right? So now I need some stuff opened up. Can you open that stuff up for me, please? You're about communicating. Now we have a lot of stuff in here, right? So what would I do with this stuff? Just take it out individually? So here's what I do in real world. I'll grab it. Is that quicker? And then I'm just going to start putting stuff on the bottom that I don't need. Of course, this was, there's just stuff in here that would not normally be like this. What I'm saying is it's quick, right? And I start putting stuff where it would normally live. I see you over there. It's all about time and trying to hurry, but also not being contaminant and putting stuff. This is called gathering your sharps, anything that's a sharp or countable item. Did you do that, Sam? No. Yeah. Right. Normally not like this. We're not going to have sutures in there in your packs. Make sure they're not in there. We're going to have them peel packed and open them up or get new ones, okay? Because they normally are not in a pack. That goes for ties too, but since you have them, I'll keep them. Hopefully you have your POV all wrapped up nice, but I got sabotaged by Sam here. So where's this going to go? I'll lay everything in this basin here. I got my POV in here. Anything that's countable, I'll take out the tip. And since this holster is busted and doesn't work, Sam, get a new holster before you wrap this up, okay? Because we're not going to be able to use that. Yep. Okay. So we have our light handles. We'll put that in there. We have our random laps and this is probably the worst example of a pack you should have grabbed, Sam. Thanks for... But if we need to get some new laps that are not wrapped right or hard to count, grab them, right? But I like to just put them where it's countable in the area it's going to count and normally where it's going to live. You got our blue towels, which are also not wrapped. So make sure they're in that perfect rectangle, not half, because what you're going to do is establish your 4 blue towels and obviously any extras, because that's not how they're normally going to come in a pack, right? Halfway. I know we're in the lab, but Does anyone remember how to open that up? God damn, Sam. Yeah, terrible, man. This pack looked like someone took a shit in it. So was that open up properly? Was that away just like a gown? Okay, good. So you're gonna wait for me to grab it and then you'll check for holes, but give me 1 second, I'll be there, okay? So during your evaluation, that person will open up, but it's about communicating. If you open it up and I'm over here busy doing my own thing, you just gotta communicate. Say, hey Brad, your tray is open when you're ready, okay? That's all I really am looking for. Yes, ma'am, I'll be right there. So in here, like, oh, what do I do? Take this off, hand that to you. Chemical indicator is good, you agree?
Yeah.
Okay, good. And then I'll stand over here and wait while you hold that up and check the perforations. No, not the tray. There you go. Yes, ma'am. Said look it up to the light. Look for any holes. Very thorough all the way around. It's a big blanket or a big blanket. It's a big wrap. All right. So if I was a tech and I don't wait, I just go like this because it's heavy and like, ugh, and it's got holes in it. This whole thing's contaminated. So we got to be very careful. Orthopedics is big on that. So this tray is going to go vertical like this, right? Now I need all that rest of that stuff open up. When you get a chance, can you open it up for me, please and thank you? I'll grab some of it because I know it's hard to. If you want to grab, just keep opening and I'll keep grabbing. So as you're grabbing it, you're like, where does this go? It already lives on your mayo, so just start putting stuff on your mayo. As I'm keeping on working, I set up my, getting ready for a count typically, but the stuff just needs to be open. Are you there? Just, oh. There you go. So just about communicating, say I'm ready or something. A little whistle, something. Otherwise, I'm not going to hear you. I'm just going to keep going. Yep. I was just joking about the whistle. That's going to be. Did you just whistle at me? Ready? See? So this part in the tray, I started saying to myself, all right, what am I going to do? I like to personally just put something quickly right here and take everything out so I can work off a clean slate.
Ready?
Be right there in 2 seconds. All right. Try not to turn my back to the field. All right, so I look in here, I feel around, there's nothing on the bottom. I can take an extra blue towel if I have it. I like to just put it on the bottom for contrast. And just start setting up like I would do for a count. Is that too far? No, you're good. Just let me know when you're there. You there? No worries, I'm gonna keep working. And I like to put traumatic to non-traumatic on one side. You guys already heard that. Ready? Give me 1 second. Be there in 2 seconds. See. And you're just keeping moving. I try to set this up in the order it's going to be used, but I'll show you that in a minute. Anything else need to be open? You got a drape? Can you get that drape open, please? Thank you. I need that drape open, yes. What questions you guys have so far? Pretty simple, right? Not complicated. Can anyone just tab my little glasses? It's falling. Yeah. Is it still filming?
Yeah.
All right, good. So since I did this, obviously I can do it just a temporary thing to have. I'm going to use this as my 4 blue towels. 1 you, 1 me, whatever you want to do. I really don't care as long as you have 4 blue towels for squaring off. Are you? Yep. Good. Just temporary waiting. And then I'm going to put the drapes in the order you're going to be using them. Almost solid. So how are they going to go, right? We're going to go with 3/4 on top, 4 blue towels, right? Doctor's gloves, preferably that way. So just in the order you're going to use it, right? Now what goes in here is the question. You're like, oh, what do I do with this? All right, we got our tray ready to go. I need stuff out of here. What you are going to take out of here is the scissors. And you can do this after we do a count. We have just the right angle. We have the Maryland. We have an L hook, and I'll tell you about it in a minute, but there really is no particular way to put that on here. We are going to do the 530 lens. I checked for any holes real quick, or not holes, any cracks. I don't see anything. I got the anti-fog. I just go ahead and put that on the anti-fog. Right. Now down below here, a lot of people forget this stuff you can leave in. This is a 10, and this is just an aspiration needle. We have the insulation tubing, so I'm just going to go ahead and lay this in here. We have the fiber optic wire. I'm just going to go ahead and lay that in there. I have the camera on light head. I'm just going to leave it in there, making sure it's nice and wrapped so when you pass it off, it's not going to be a big deal, right? All right. Then I have there. Then I have the drapes that are going to be used in the order, so I just lay it right on there. It's fine. So when the doctor comes in, we can just come up and drape together, right? So we're looking at here. You guys can come a little closer if you want. What questions do you have? Obviously, this is subjective. Everyone has an opinion. There is no, as long as it's uniformed in some fashion. The only thing I would have is we're ready for a count here, right? We got our hypos all in one place. I don't have any blades. If someone wants to grab a 10 blade and a 15 blade. I feel like we're missing a knife handle too. But yeah, of course. Got a 10. Is it 11 or 15?
15.
Oh shoot.
Oh, did you want me 11?
It's okay.
Sorry.
It's alright. I meant 11.
Okay, sorry.
But since you grabbed it, it's fine. So we're looking at this here, right? So we're going to we'll do a count. We'll go through a count in the final evaluation. Pretty simple. It's not anything we have not done before. I'll show you how to set this up. As soon as we do a count, we'll take everything off the stringer, leave the stringer on beforehand.
Are we taking these instruments out before the count?
No. You can set this all up. That's fine. Good question, though. We'll get this count done, and then I'll give you time to set up.
Do you have to count those as well?
No, you do not. Yeah, it really is hospital policy. It's about what can fit through this trocar, or if we go open, can this get lost in the abdominal cavity? It's a hospital's policy on this, and I say a lot of them say no. So we just count the trays. We're counting this tray because if we go open, we're ready to go.
Right.
So if we don't go open, they don't care. We won't do a final count. We'll just do a soft count, which is just your laps and retex and small veins. But we're anticipating it's going to hit the fan, right? No, I forgot. Oh, so we're going to load this blade up. Does anyone want to gown in with me and drape? So what do we do first? Do we do a 10 blade or the 15 blade? We're going to do a 15 blade first because we're going to do laparoscopic first. So it's good to have two number 3 knife handles so you can just load up the 10 blade. But in this case we don't, but we'll make sure this tray does. So you're keeping things organized. Where did this live? I forget. So I like to have a little, we'll put this in the order we're going to use it. So you think about it, what are we going to do first? Obviously we'll get very simple process of setting up any type of laparoscopic case. Can you push this up for me? I feel like I'm some professor. Yeah. So what questions do you guys have at all? At all? Pretty simple, right?
Yep.
And then we're going to drape. The only thing I would say is you're anticipating for ties for going any type of bleeding. So I'll have those ready. All right. So maybe with the tie and a passer. Obviously this tray has nothing. We're going to use a right angle. So I would have that ready to go. Maybe even have hypothetically a suture ready to go. So I'll have, obviously you can have your suture loaded and just have it on the table. This is for closure purposes, so I'll leave it alone. So if we're going to have, I'm not sure what surgery I'm going to give you, but whatever surgery you think is going to happen throughout the middle of the surgery, you can just have it ready to go. So if it's the small bowel, maybe there's the 3-0 pop-offs that are ready to go. You're loaded up. You can actually have two knife hand or two needle drivers ready to go. In this case, right, we have a free tie. I like to just put them on my non-perforated towel clamps. Probably I showed you this. All this stuff's falling because my towel roll sucks. All right, so it's kind of ready to go. So what you're doing is you're anticipating going open, right? So if you have your tonsil or your right angle, so it's kind of like anticipating. So when we go open, we can just switch stuff over to the actual male, and I'll show you that when you get to the actual table. Are you ready to drape? All right. Who's my anesthesia person? I'm sweating. So this is obviously for the doctor. If he's not in yet, we just set it off to the side because a lot of people say, what do I do? Well, if he's not here, just move it. The reason I have it set it up in the order you're going to use it is because that's the way the CST wants you to know, right? So what's the first thing we're going to do? 3/4. All right, so you're on that side, my dear. And so your evaluation is you and your assistant, and we'll have masks on, but I know it's hot in here. So what I am looking for is see how far I am at and see how close you're at. So don't come up all hot. Right? You're going to contaminate yourself, right? So let's come down a little bit further. I want to make sure you have it, right? And you're staying away. So then we center ourselves. Make sure we have proper distance. We want to do feet first. The whole objective is to try to just cover the feet. Ready? And it's not rocket science. Just kind of go over the feet. Drop it. Then go over the top and drop, right? It's not, these 3/4 is probably terrible. You probably want a half sheet, or that's not going to be more lengthwise. But the objective is to try to get where the prep side is and covered. Now, if this was not covered fully, what would you do? Probably get some blue towels and put the blue towels over. So now we're going to do some 4 blue towels. So you want to come on this side? I'm going to give it to you, or you can give it to me, either way. But since this is my table, I need to be ready for the doctor. I'll grab all 4 of them. And I'll hand it. You do one. Do the one closest to you first. Have you ever done it before? No. Come on, it doesn't.
So this one goes at the front.
Here, you switch up. I'll show you. You may come back this way. Hold all 4. And grab and give it to me.
Okay.
So what I want to do, if you're going to be squaring off, so I want you to tuck in like this. You want to do the closest one to you. I know this belly is as large as life, and it's not normal, so it's going to slide a little bit, but the objective is not to touch the skin with your hands, and you want to just come in, wrap, and walk away. Right? Then do the top. Again, making sure your hands are under. Wrap. Right? It's going to fall a little bit because this is not a normal, it's a mannequin, right? It's plastic. Right? You can actually staple here if you want, or put clamps here to make them stay in place. And then you're going to go around to the other side and do that side like I did, okay? Okay, stay right there. So now we get to this point. Got a down sheet, we square it off, we got the big belly sticking out. You ask yourself, what do I do with this? Is it going to fit over that? What I am going to ask you is to cut in the corners. And I would say ask before you do it. Cut about what are we looking at here? 9 inches in, somewhere in there. What this is doing is making this a universal drape, because a lot of these patients are a little bit overweight and they're not going to fit around the perimeter. I would leave the stickies on though, and I'll tell you why. Because once you have the stickies off, it's going to stick and it's not going to be able to move it around, right? All right, or this way. You can help me out, okay? You could be anesthesia. So we use that. We got the head. We want to center this. Right? You got it? You just back out a little bit. Very calm. If this moves, then we did something wrong, right? So make sure it's unfolded. Right? Hold in this part. We're going to go with the head first. Do you see this part here? Come out of it, because it's going to extend out. Have your hand in like this, like this. Do you see that? Okay. Do you see that part that's inside there?
Yeah.
You have to get inside of it. Do you see how my hand is? There you go. Get in there. The other way. Turn it inwards. There you go. And watch. See how your hand. See how close your hand is to that monitor. All right. Good. So in and just give that the anesthesia. Come on, wake up, anesthesia. All right. You just wait for him. We're going to do the same thing for the feet, right? And no worry, no worry. Let her do it. This side, right? It's holding this, and now we're just going to go out with our hand, right? And just drop. Now we can let go of this. It was easy. Right? Now we're looking at this. Do you see how, if you guys can come closer if you want. I have to do my. And obviously this is a garbage. Oh shit, I'm sorry. I apologize, I didn't mean to do that. So we're looking at this, the reason I cut, right? So now we take these stickies off. And now we can stick it around the perimeter because these bellies are a little bit larger than normal, right?
Should I do this one?
Yeah. I'd rather you do something and let the doctor say, what are you doing? Than just standing there looking at them. Obviously, if you're doing this, your instinct is right. Unless you say don't do anything. Because if you stick it on a towel, it's wrong. I want to get it up above the blue towel. And even this, it's not bad, but sometimes. You do this because, like I said, a lot of the patients are a little bit larger than normal. All right, we get to this. Obviously, anesthesia would be up more, but I gotcha. It's not a big deal. So what do you do at this stage? Yeah, so I'm just going to do what I would normally do, right? Your instinct is, as a tech, as the assistant, I want you to come grab the basin, come around. So as the tech, all it matters to you is setting your field up. Don't worry about, just leave it. Because in real world, you're not going to be able to touch it. And if you see a garbage, you can grab it. So you're going to come this side. And actually, come right here, my dear. Come right here. You're going to start passing off, okay? Can someone play the nurse for me? So for you guys as a tech and your actual evaluation, you're just coming and getting your field set up. Right? Can I reach here? Can I still hand stuff to the doctor? Can I still reach stuff? Now, in reality, this probably should be on this side, but we screwed up. So you're going to play the nurse for me, okay? So I'm going to show you, for you guys, the objective is to start passing stuff off, and I'll show you once, okay? Okay, we're going to look at this, make sure there's no knots before we throw off. The nurse is not going to be in our field. This has got to go through here. So which side do I throw off? That's the thing. If you don't know, you ask, but this is the right side. So it's a pendulum, right? We're coming out. Now we're making sure we have enough slack. The nurse is just going to start pulling crap. So I start saying, okay, where's it going to go? It's going to be tied down here, here, and eventually sitting right here, right? And I'll let the nurse figure that out. That's the wrong one. There you go. So I'm making sure this does not go below the field, right? And good. So think about it. The actual camera is going to be like this. So can we reach it? Yeah, we can reach it. So now we have the fiber optic wire. Do you want to do one? Yeah. So you got to figure out which. I'll just do it so I can show them. So you say to yourself, which side do you guys think goes off? This one? This one?
No, that's...
This one? You would be right. But if you're not sure, make sure you ask. Because if this is the last one, we're screwed, right? Or you delayed the case. So this twist like this says, oh, you did it. Perfect. You're right on. So the whole idea is to follow this along.